for, okay, so just whenever you see the word carcinoma or sarcoma, that means malignant cancer. Okay. Basal cell carcinoma invades all 5 layers of the epidermal layer into the dermal layer. Squamous cell carcinoma only invades the outer layer of the epidermis. Like it invades more than one layer of the epidermis, but it doesn't penetrate into the dermal layer. Okay. So it's gonna be contained and compartmentalized in the epidermis. And then melanoma invades all the way down through the epidermal layer, the dermal layer, and into the subdural or subcutaneous layer. Okay.
Subcutaneous. Okay.
That's it. That was the point I was trying to make, and it obviously took way too long because we couldn't hear each other.
Okay. So so all three we can see by, like, it will be visible by your eye, like in
Yeah,
a
they're
couple of
they're on the
seconds.
surface of your skin, right? They're
Yeah,
all going to be visible.
but it's just depend like how deep they are.
How deep
So
they are and how aggressive they work, right? And we already know how aggressive they are because we've got the three Brady sisters, right? Basal
yes.
cell, squamous cell, and melanoma, but they're not in order of how deep they are. Basal cell permeates down to the dermal layer, which is 2 layers down. Squamous cell stays on the very top epidermal layer, and melanoma invades all the way down through all 3 layers.
Okay.
Okay. So
Okay,
that
got it.
part isn't the Brady sisters. Okay. You have to just remember that. It would be convenient if basal cell was second deepest, right? It would be easy, but it's just not anatomically and pathophysiology that way.
Okay.
Okay. Let's talk about the ABCDE squared of how to identify the moles that cause melanoma. Okay.
Okay.
Let's talk about those. Okay. So what are we looking for if it's A? What does A in the ABCDE stand for?
Uh, Asymmetric, I remember.
Asymmetrical, which means they're not symmetrical. They don't have a nice, clean, round shape.
Okay,
Okay. What does D stand
asymmetrical.
for?
The border.
Yep. Borders.
Mm-hmm. So is the like they just look like out of shape, like out of shape. They are not um
Yeah. They have an irregular border.
okay. Yep.
Okay. What does C stand for?
Color.
Yep. They're discolored, right? They have multiple different colors in them.
Okay.
Okay. What does D stand for?
Um I think it's about measuring. Is that
Yep.
diameter?
Diameter.
Diameter.
So it has to be 6 millimeters in diameter or the same size as a number two pencil eraser or larger. So 6 millimeters or larger than a number two pencil eraser. And that would be a
Yep.
large diameter. Large that would be scary, that would be malignant. Okay.
So 6 is the highest?
No, 6 millimeters or greater than 6 millimeters.
Oh, okay.
Anything smaller than that, and we consider it insignificant still. Does that make sense?
Okay, so 6 millimeters is our the initial kind of initial size.
Yeah, if it's the size of a pencil eraser, on the back of a number two pencil, then it would be scary and we'd have to start looking at it. Okay.
Okay.
That's it.
Okay. Nice.
Elevate. And then E, what's E?
I don't remember E.
Elevation. It's going to have some
Elevation.
elevation.
You just said it.
I just said it.
I know. I
I'm
didn't
getting
hear.
I'm getting tired in my old age.
Oh.
Okay,
Well,
elevation.
we all old over here.
Elevation. Okay. What is the
Elevation.
last E? There's one more E. E squared.
E squared.
There's two E's. Elevation's one of them.
Oh.
And the last one is Charles Darwin.
Okay. Charles Darwin. What that mean?
Charles Darwin invented the big theory of.
I don't know I don't know who Charles Darwin is.
Charles Darwin was the scientist who developed the theory of evolution.
Oh, evolution. So
So that's
what's
the
the
name. That's the name of the scientist who developed the theory of evolution.
okay? So what's related to like our cancer cells here?
So it means the change of diameter, shape, color, and elevation over time. So if a tumor is starting to grow, if a melanoma or a black mark on the skin starts to grow and change shape, is that an active tumor?
Yes.
That means it's cancerous. If it's not changing shape at all, when you assess it and assess it and assess it. So if you see the same patient one time a month for 3 months, and the melanoma, like the black mark, the moles on their skin, do not change shape and aren't active, are they cancerous?
Uh, no.
No,
They
they're not active. They're not changing shape or growing or moving, so they're not active.
okay.
So those are tumors that, yeah, we watch them. We're gonna watch them, but are we really concerned? No, we're not concerned until they start to become active.
Okay.
Okay,
Okay.
we good?
Yep.
Okay, let's talk about burns. What kind of burns do we have?
Okay. So we have three stages of burns,
Yep, three degrees. Yep.
3 degrees. So the first one, um, is just like that your skin will be. Oh no, that's pressure also. That your skin will be intact. Um,
Say sunburn.
Sunburn. Yeah.
Just say sunburn. That's a first degree burn. Sunburn, right? What
Okay.
makes a sunburn different than a second degree burn? How does it become different?
The second degree will have a blister. Yes, we'll have a
There's going to be
blister.
an intact blister. That is correct. An intact blister. Okay, what about a third degree burn? What makes a third degree burn different?
The third degree is caused by the
Say it again. What did you say?
is caused by secondary. I don't know why I always forget this word. Secondary what? The second type of healing.
So yeah, third degree burns are going to be completely burned through. The blisters from a second degree burn are going to rupture. They're going to be leaking fluid, and the third degree burn has damaged or destroyed all of the nerves, so there will be no pain association on a third degree burn. Okay, where the third degree burn has pain is on the periphery where there's second and first degree burns. Then the patient will have pain there, but the heart of the burn at third degree, there will be no pain association for the patient.
So in the periphery, you mean like in the border of the burn?
Yeah, because you don't have, hey, again, have you ever burned yourself?
I don't remember though.
Okay, I'm just saying, have you seen someone who's been burned?
Yes. Yeah.
Okay. If again, the outside of the burn, okay, I'm gonna just tell you how it is. In every burn that you see, if you have a first degree burn and only a first degree burn, you only have a first degree burn, right?
Yeah.
If you get a second degree burn, you have a first degree burn and a second degree burn, because the middle of the burn is going to be second degree. But as you move more towards the border between where the burn is and where normal tissue and skin is, that's going to be a first degree burn transitioning back to normal tissue.
So is a border called periphery?
Yeah.
Okay. Got it.
Okay. And if you have a third degree burn, so if I have a third degree burn, what other kinds of burns do I have with a third degree that I have to have a third degree burn?
So you'll have the first and the second.
Yes, you're going to have the first and the second, and they're going to move out. So I'm going to have a third degree in the center. I'm going to have a second degree on the outside of that. And then I'm going to transition to a first degree burn on the outside of that one. And then I'm going to transition back to normal tissue.
Oh my God. Those burns. Okay.
You can do it. Okay. The things that you need to remember for third degree burns that are really, really sketchy and scary, and these are for all burns too, is the change in fluid dynamics in the body because of burns.
And there is no nerve associated with that. The
Yeah.
pain.
Yeah, no, I don't care if you're second degree, first degree, third degree burns. If you have burns on your body, those burns are causing a change in the vasculature of your body. Okay. They are allowing fluid to be released from your blood into the tissues. And I don't care if that's first degree, second degree, third degree. There is a change, and they call that plasma permeability. Okay. The plasma permeability of your blood vessels is changing because you were burned. And that can be as simple as a first degree skin burn from sun, right? Sunburn. Have you ever been sunburned?
Nope.
Okay, well then I'm lost
But
because most of us have been sunburned.
I have my friend once we went hiking, and she was terrifying. She said, Zakia, I will have sunburn in my, like, on her neck. I was like, it was like completely red.
Yeah, bacon. She
And
cooks
she
herself
said
like
like it's
bacon.
painful, like after she go home, like because she forgot to put her sunscreen. And she said, Zakia, those ones are like just painful.
They hurt. Yeah, sunburns hurt. Hey, one of the things I'm talking about
Well, thank
sunburn.
God that I'm black.
Yeah, no, you have dark skin, so you're not as predisposed to have sunburn than the rest of us that are white with
Yeah.
Caucasian skin. So that's why you didn't burn as easily. I'm going to tell you though, white people who get sunburned, the first thing that you notice is they are thirsty. They want to drink a lot of water because they're losing water from their vasculature to their extracellular space. And
Oh, okay.
that's because of the breakdown of the plasma membrane, and the plasma proteins start to leak out of their blood into their extracellular fluid, and they take water with them. And so people who get sunburned get really really thirsty.
That's why.
Yes.
Hmm.
Okay.
So it's called plasma permeability,
Yeah. Your
third
plasma.
degree.
Okay. So look on the notes on page number 6.
I am in
Okay.
the note. Uh-huh.
Okay. So look at page number 6. So there's one that says number 2, cardiovascular changes. Start reading right there.
Cardiovascular changes. Okay, capillary permeability is increased, leading to the loss of intervascular vascular proteins and fluids into the interstitial compartment. So
Okay. You tell me what
vascular.
happened. What did that line just tell you?
So we have protein that's like, no, we have vasodilation that led the protein to leave the vascular space to the interstitial place, and then we have this the asmo like not the not oncologic osmotic pressure that will pull the water outside, like out of the vascular too, because the protein is being out of the vascular size,
Yep,
out of the
yep,
vascular,
when
yeah,
the protein leaves,
circulation. Yep.
protein acts similar to salt. Where
Yes.
salt goes, water follows. Where protein goes, water follows. Just like salt.
Okay, so we will be hypovolemic shock. That will lead to hypovolemic shock because the
Yep.
vascular depletion despite um, fluid replacement.
Yep.
Hmm, great. Okay, let's finish it. So peripheral and the splanching
Where
vessel organ.
vascular depletion, despite fluid replacement, leads to hypovolemic shock. Okay, then peripheral and splenic is the word you're looking for.
Splenic,
Splenic
yeah.
or visceral organs vasoconstrict, and that vasoconstriction occurs in the myocardial and okay, so vasoconstriction occurs and myocardial contractibility decreases. So the blood pressure goes down and your heart loses the ability to pump blood.
Yeah, because we have hypovolemic, like we'll be
Yep.
hypovolemic. Yeah.
We're on our way to hypovolemic shock and death. That's where we're headed right now. As you read this, you need to be thinking hypovolemic shock leading to what? To death. They're dying. This person's going to die.
Okay. Even though they will have fluid replacement, but that will not help.
No, 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 no. That will help. We are doing fluid replacement to intervene. Okay.
Yeah, but like,
Untreated hypovolemic shock leads to death. And
okay,
fluid replacement is the number one thing that we as nurses do to stave off hypovolemic shock, is to replace their fluids and start to get their blood back to normal.
okay, and
Okay.
then okay, so these changes coupled with fluid loss from the burn wound, and then result in systemic hypotension and end organ hypoperfusion.
Okay. So right there, that last phrase,
Yeah.
okay, systemic hypotension and end organ hypoperfusion. In your words, you explain those two statements to me, so I know
Okay.
you understand them.
Hypoperfusion to the organ, that means it's lack of the blood circulation to that organ.
When organs do not get oxygen from the blood, what happens to them?
They decrease in how to say that they don't do the regular activity that they do because there is no oxygen. So there
Not
is
only do
no.
they not do the activity that they do that they would normally do, they die. The organs shut down and just die.
I
So if
thought that perfusion here that means they, yeah, so lack of blood and that lack of oxygen at well, like as well. So then they will die. So they will be ischemic and die.
Yep, they will be ischemic and die. And not only are they ischemic and die, but what are the statement in front of that say? So burn wound results in what kind of hypotension?
Hypovolemic.
Well, no, look in front of hypoperfusion, right? It says so it says these changes coupled with fluid loss from the burn wound result in systemic hypotension. What's the term systemic mean?
So systemic, that's mean related to your so the whole body, like your lungs.
So the whole body has low blood pressure,
Yeah.
and the end state of the organs in the body, they all collectively are not getting any blood. So it's not like the kidneys not getting blood. The kidneys, the lungs, the liver, the spleen, the heart, the brain, all collectively are not getting any blood that they need. Is that a bad thing?
Oh yeah.
So not so yeah. So order in time. The first organ to run out to stop working when you run out of blood is your brain. The neural tissue is going to be the first to start to die. Do you know what the second tissue that starts to die is?
Kidneys.
Your kidneys, right? Now your kidneys are dying. So your brain's dying in about 5 minutes. Your kidneys are dying in between 20 and 30. What's next between the liver, the lungs, and the heart? Who's next to die?
What's next to that?
Yeah, after the kidneys, who's next to die? I'm guessing it's your lungs.
That's what I want to say.
You start to get edema in your lungs and fluid fill up in your lungs. You know,
Edema
whatever
in the lungs,
blood is going to collect in your lungs, and then your lungs are going to become ineffective and start to die, and then probably your heart after that. Myocardial tissue does not like to be deprived of oxygen, so it's going to start dying. And then, oh, by the way, then your liver and your spleen, they start to die. So yeah, you're pretty much going down a bad route, right? Everything's dying all at once. They're all dying together.
So that statement, like vascular depletion despite fluid replacement, is not making any sense then.
Yeah, when they get that far down, when they get hypotension systemically and they start getting end state or end organ hypoperfusion, again, it is extremely difficult to bring these people back. They're uncompensated shock, and it's going to be hard to bring. If we're lucky, we may bring them back, but they're most likely to die.
Okay.
So our goal as nurses is to get these patients early enough to start fluid replacement and start to do things to the burns and the damage that's been done to keep that fluid loss from becoming lethal. We're doing fluid replacement and we're treating the injuries to get those injuries to stop giving up fluid.
Okay.
That's what we're trying to do.
Okay, you beat that to death.
I think we needed to. I think that helped you to beat that to death.
Yeah.
It's one thing to know what first, second, and third degree burns are, and how deep they are, and all that stuff. It's totally different to understand chemically and systemically and system wise what's going on with burns and why burns are really bad. I mean, oh yeah, I got a first degree burn from a sunburn on my back of my neck and the back of my arms, and why you feel like crap for 3 days. It's because you're losing water at the vascular level in your tissues.
So even like that first degree burns that really will affect your periphery, like will affect your plasma osmolarity, and they will just start to leak from your vascular side. So that will, but with some burns, that will be more local. No, all the burns is local.
Yeah, sunburns can become a significant issue when they're over 28%. If you get over 28% sunburn in your body, you can die from that. People can die from excessive sunburn.
Okay. Makes sense.
Who do you think is the most susceptible to massive sunburn death? Little kids, regular adults, or old adults? Geriatrics. Who's the most at risk to die from a sunburn?
You said who's the last people that you
Geriatric,
said?
old people.
Oh, JR what?
Geriatric is the word for really, really old people.
Geriatric. Okay. So I think it's kids.
Going to be kids because we can leave them out in the sun for only a few minutes and they can get a massive sunburn over a huge part of their body very quickly. And it
Yeah,
can
I think
become very, very damaging to their system. And they can have multi-system organ failure very, very quickly, a child. So definitely want to cover kids up when you're outside. And again, make sure they're not getting a lot of sun. And that's the reason why.
okay. Got it.
Okay, so here's what I'm going to ask you to do. I'm going to ask you to read section 2, 3, and 4, page 6 and 7 of our notes on your own. So when we come back, you can teach those pieces: the fluid imbalance piece, the metabolic changes, and the immunological changes of burns. I think that would be really helpful for you.
Okay, yeah, circulation and no airways, breathing, circulation, and what?
And then the metabolic changes and the burn.
Even though I don't hear you, but I think you mean like what we have in number 7 and number 6, right?
Yeah, read all of page 6 and read all of page 7. So when I see you tomorrow or the next day or whenever I see you, you'll be ready to teach me those pieces.
Great.
Okay, we good?
Mm-hmm.
Okay, I'm tired. I'm going to bed.
Okay, thank you very much.
You go to bed too.
Yeah, oh, I will do some statistic and then I will go to bed.
Okay.
Yeah, but thank you. Thank you, Chris.
Have a good night, my dear.
Okay, you too.
Yeah.
Bye-bye.
Bye.